Indoor scent exposure functions as a low-dose endocrine signal. This includes perfumes and fragranced indoor products, such as candles or diffusers, which release volatile organic compounds. These are inhaled efficiently, absorbed across respiratory epithelium, bypassing hepatic metabolism. We are most concerned about synthetic fragrances. Phthalates act as endocrine active compounds by binding peroxisome proliferator-activated receptors and mimicking estrogen signaling. At the reproductive axis, this disrupts hypothalamic gonadotropin-releasing hormone pulsatility, reduces pituitary luteinizing hormone output, and suppresses gonadal steroidogenesis through downregulation of steroidogenic acute regulatory protein and aromatase imbalance, shifting testosterone to estrogen balance toward relative hyperestrogenism. Synthetic musks used in perfumes accumulate in adipose tissue due to high lipophilicity and slow metabolism. They interfere with thyroid hormone transport and deiodinase activity, producing a functional hypothyroid state characterized by fatigue, slowed cognition, and reduced metabolic rate through disruption of hypothalamic feedback sensing and peripheral hormone activation. Aerosolized cleaning products generate reactive aldehydes and fine particulates that activate pulmonary macrophages and nuclear factor kappa B inflammatory signaling. This systemic inflammatory response leads to cortisol dysregulation, sleep disturbance, and insulin resistance through impaired glucocorticoid signaling feedback loops. Fragrances also activate trigeminal sensory pathways through transient receptor potential channels, producing neurogenic inflammation mediated by calcitonin gene-related peptide release. This mechanism links environmental scent exposure to migraine susceptibility and central sensitization via persistent nociceptive amplification. Dermal exposure from fragrance detergents introduces oxidized allergens such as limonene hydroperoxides that trigger type 4 hypersensitivity reactions through T-cell-mediated immune activation, clinically presenting as chronic dermatitis with persistent inflammatory skin barrier dysfunction. Even natural essential oils, such as lavender, may exert mild endocrine effects through cytochrome enzyme modulation and oxidative byproduct formation when aerosolized at high concentration, but their persistence and receptor binding potency remain lower than synthetic compounds. Scents are chemical exposures that can interfere with hormones. Reduce and avoid unnecessary scented products whenever possible, especially in closed indoor spaces.